Hi there, welcome to my Facebook Live. I'm Dr. Shiroko Sokitch, author of the book Healing When It Seems Impossible, 7 Keys to Defy the Odds, and the owner of Heart to Heart Medical Center in Santa Rosa, California. I hope you're having a wonderful day so far. I am here today to talk to you about thyroid disorders. And thyroid is a little tiny gland that's right here at the base of your neck. And it may never show abnormal, but sometimes it can actually look swollen or get really swollen down in here. A lot of people ask me where the thyroid gland is. Literally right here. And it regulates your metabolism, but your metabolism is many things besides your weight. So it is also regulating your energy levels because it helps you have energy during the day. And I'm going to give you a list of some of the symptoms that you might have if you had thyroid issues. So first of all, of course, there could be underlying depression. You could start to feel more depressed or like you don't have enough energy to get through the day. You may actually have too much weight loss or not enough weight loss, and both of them can be symptoms of the same problem, both hypo, which is low thyroid, or hyper, which is high thyroid. I've had patients who are super thin and who suddenly lost a bunch of weight, but they were hypo, low, meaning low thyroid. And I've had a patient who was very overweight who had hyperthyroid. So you can have like what you normally think would be that if you were hypo, you'd gain weight, and if you were hyper, you would lose weight. But the weight can be different for different people. So what you want to pay attention to is if your weight changes suddenly or stops following the normal patterns that you're used to, then you would say, oh, okay, maybe I have a thyroid issue. Depression, hard to get out of bed, unusual headaches. I actually have patients who tell me that they have headaches every single day, and often I find that if they have a headache every single day in the same place, and it can be in different places, but if they have a headache every single day, that could be a sign of thyroid imbalance. Also vision problems, so when you can't see right, like when your vision doesn't work right, or it suddenly changes so you have more blurred vision or more inability to focus your vision, those could be issues for your thyroid. And like I said, depression or feeling low energy or mood swings. So when you could have ups and downs of moods, that could be a thyroid issue. You could also get digestive problems. And again, it could be diarrhea, which could be a sign of too much thyroid or hyperthyroid, or constipation or chronic sort of irritable bowel where you feel bloated really easily and you don't digest your food well. I've had clients who suddenly can't digest their food properly, and it may not be a digestive problem. It could be a hypothyroid problem. You could have skin issues where your skin could get really dry for no apparent reason, or you could start having certain breakouts of your skin that you didn't have before, and that could be an issue. And sensitivity to temperature. So a lot of people who are hypo, which is again low thyroid, could have very icy cold hands. They could start having what's called Raynaud's phenomenon, where their hands or feet can turn blue in the cold, and they have no tolerance for temperature shifts. So that could be an issue with thyroid as well. You could have, again, swelling here, or feel like there's a nodule here at the base of your throat. And that could be, you could also get tender. So tender thyroid is actually significant. You should let someone know if you have a tender thyroid, because there's a thing called thyroiditis where the thyroid can suddenly become really inflamed, and that has to be treated kind of right away, so you should let somebody know. Now, you may not be born with thyroid issues. You may develop them later in life, and in fact, most people do. And some of the risk factors for developing thyroid issues are infections. So you, after Epstein-Barr virus, you could get Hashimoto's, which is the autoimmune version of thyroid. You could also get hypothyroidism after childbirth or after being pregnant. It's actually not uncommon to see women suddenly develop thyroid issues after being pregnant, and even if the pregnancy was normal. You could have even chronic infections in your gut that would cause a thyroid problem that you may be not aware of having had. So paying attention to all kinds of things will really help you. There are medications that can contribute to thyroid imbalance, like lithium is a medication that some people get put on, and it can cause low thyroid, and there are other medications that I can't list right now, but that could cause low thyroid. And then how would you diagnose having a thyroid imbalance? So this is difficult because there are many steps in the production of thyroid hormone, and it starts up in your brain. So your brain produces a hormone that's called thyroid stimulating hormone that sends a signal to the thyroid to produce the amount of hormone that you need. Now, if the brain does not get a response from the thyroid, then it starts pumping out more of this thyroid stimulating hormone, which is called TSH, on a blood test. And so when your thyroid's not working, and this is a standard Western medical test, when your thyroid's not working properly, your TSH goes up. And so when somebody says your TSH is elevated, then that means that your thyroid's not working properly, and your brain is trying to tell your thyroid what to do. So it's saying, wake up, wake up, wake up. And the higher the number goes, the less likely it is that your thyroid is working. When that number goes way, way low, then that means that you're getting too much thyroid hormone. And there's a range that we consider normal, and in Western medicine, that range is between 0.5 to 4.5. And in my world, that number is between 1 and 2. And so when it goes up higher than 2, I start to think, is there something missing in the thyroid hormone production? There are 10 steps in thyroid hormone production, and we measure only a few of those steps. And so the accuracy of the testing could also come to question. And so your symptoms, in addition to your labs, in addition to what's going on in your life, and possibly other things like thyroid needs selenium in order to function. That's a mineral, and you need a certain amount of selenium in order for your thyroid to work. So another thing you could look at is your selenium levels, and you want to measure that in the blood. So there's a test called the RBC Selenium level, and that is what you should ask for. Also, iodine is important for thyroid, and you've probably seen iodized salt being sold. That's because there are many places in the world where, in the inland, where there's no iodine in the natural soil, they can't get enough iodine, and so they'll develop this big swollen thyroid here that could be not tender. It's because they don't have enough iodine. It's called a goiter. And so you could have low iodine, you could have low selenium, you could even, thyroid needs iron, but it needs the right amount. The thyroid is a very delicate organ, and it needs the right amount of everything in order to work. We call that Goldilocks, because if it's too much of something or too little of something, it's not going to work right. And so it needs just the right amount of support. In Chinese medicine, the thyroid is connected to the immune system, because in Chinese medicine, the nose, the throat, the physical lungs, the large intestine, your skin, and the thyroid, which is in the pathway of the lung meridian, are all connected to your ability to protect yourself from things that come in from outside, which would be the immune system. And so when your whole immune system is out of balance, then the thyroid could also be out of balance. A lot of people ask me about the thyroid all the time, and I work with very, very many people. It's pretty common these days for people to have Hashimoto's, which is an autoimmune condition of the thyroid, where the immune system is attacking the thyroid and making it not work well. There's also another condition called Graves' disease, which is the autoimmune condition that causes the thyroid to be overactive. And both of those are because the immune system is attacking the thyroid, thinking that there's something going on there. In those cases, when you have that sort of thing, what you want to do is find the root cause of the condition. You want to figure out what is the problem behind the diagnosis. So the diagnosis itself is not the cause of the condition. In functional medicine and in Chinese medicine, we look for where does this thing come from, and that could be physical, it could be an infection, it could be a chemical toxin that you've been exposed to, it could be a genetic component that is affecting you, or it could be a nutritional imbalance, or it could be an emotional component that is connected to our thyroid and the emotions that have to do with our throat area. So there's a lot of possible causes. There's a lot of possible solutions. When we decide what kind of solution, there are several ways to go, and I love to explain this because there's many options. Again, there are nutritional supplements like vitamins, like selenium. Taking selenium, you have to take, again, it's a Goldilocks, so you have to be very careful with iodine and iron in order to get the right dosing of those things. Also, actually, with selenium, you don't want to take too much selenium, you don't want to take too much iodine. So if a little is good, more is better is not the answer in this situation. So there are nutritional supplements that will support thyroid function, and if it's just, quote unquote, if it's just low thyroid, then some of those things may actually make a difference. There are also glandular products made from animal thyroid that you can buy over the counter, and those can be helpful or they can be not helpful. So again, it's very careful what you do with the thyroid. And then the third option of treatment is to take medication. And there are several kinds of medication. There are animal thyroid, which is usually made from pig thyroid, like Armour thyroid or NP thyroid, or nature thyroid. Those are all animal thyroid that are ground up and put into a tablet, and then you take that, and for some people that feels more natural and it feels more whole because it's a whole thyroid. It's replacing what your thyroid isn't producing. And I would say 50-50 of the patients that I've treated over the years, and I've literally treated thousands, do well with the animal thyroid. And then there's the pharmaceutical thyroid animal thyroid is also pharmaceutical. You get a prescription for that. But then there's something called levothyroxine or levothyroid or synthroid. Those are all what's called T4. There are 4 iodines attached to this thyroid hormone molecule. So that's why it's called T4, thyroid 4. And in order for it to be active, you have to remove one of the iodine molecules to get it to be T3. T3 has 3 iodine molecules, and it is active in giving you the energy that you need to function throughout the day. So sometimes, most people, when given thyroid medication, are given T4, which is, again, levothyroid, levothyroxine, or synthroid. And in many cases, that alone is enough for them to feel better. But for some people, they don't feel better even when given the right amount of thyroid hormone. Sometimes that is, again, the difference between taking an animal thyroid or taking T4 with a molecule of T3, which is called Cytomel, so that you're taking both kinds, and that sometimes helps kick the thyroid in. But when you have an autoimmune thyroid condition, a lot of times you have to find the root cause in order to feel better. You want to find, like, is there a hidden infection? Is there a food sensitivity? One of the food sensitivities that is very important to thyroid is gluten. A lot of people with Hashimoto's have a gluten is the cause might even be because of gluten sensitivity or celiac or something like that, because the thyroid molecule itself is kind of similar to the gluten molecule, and so you can have some confusion in the body where the thyroid molecule and a gluten molecule could be damaging. The gluten molecule could be damaging the thyroid. So that's another thing to consider. So there's a lot of things to consider when thinking about your thyroid. And if you have any questions at all about this, or about finding out what's going on with your own thyroid, please feel free to contact my office at Heart to Heart Medical Center. And I look forward to hearing from you, and I hope you have a wonderful day. Thank you so much.